All right, chapter 6 in your textbook, skin and body membrane. So the biggest organ in your body. So the skin and its organs. So they call them accessory organs. So hair, nails, sweat, all of your glands. Sebaceous is oil glands. Those are all accessory organs of the skin. And they're all in the dermis layer. So you have 3 layers of skin. The epidermis, dermis. And what's the term for below? Hypodermis. Right? AKA the subcutaneous layer. All right, so let's get into the terms. Adipo is fatty. So your adipose tissue is also down here in your hypodermis subcutaneous layer. What's the other one for fat that we had? Yep, liposuction. Cutane, there you go, subcutaneous, under the skin. So if there's multiple word roots for skin, use any of them, and I'll look at it manually when you're doing your homework, and I'll give you the credit. So we got derm, dermato, derma. So there's kind of patterns on when you use each, but for you guys, since you're beginners, as long as you have skin, it's fine. It'll be fine for you. Hydro with an I stands for sweat. What's hydro with a Y? That's water. So one little tiny, W-A-T-R, one little tiny letter. Iphio, so if you have a bunch of patches, hard keratinized patches, then you have scaly skin. So the word for fish, ichthyosis, condition of scaly skin. Protein, that makes your skin tough, waterproof, makes up your nails and your hair. That's keratin. So if you have a lot of buildup of keratin, you get that scaly skin. So they call it horny tissue. Lipo we already had. Melano we had. We had all the colors already in the word root chapter, chapter 2. Myco is fungus. So you'll see this a lot. Yeast infection, that's a myco. Ringworm, myco. Athlete's foot, you can get it on your hair, anywhere in your body. Onchio is nails. If you bite your nails, it's literally onchiophagia. So you're literally eating your nails. Phagia for eating. How do you say hair in Spanish? Close enough. Sebum is oil. Right? So this is the oil glands in your body. So you have sweat glands and oil glands. Third one. So you had adipo, you had lipo, and now you have steto, all for fat. Trick for hair. Xan is yellow, xero is dry. And it's usually dry skin. So a lot of times we don't even put xeroderma. We just put xerosis, and people know it's skin. As mentioned, largest organ, some people up to about 8 pounds. What type of tissue is skin? No, not connected. Is it muscle? No. Is it nerves? Not connected, then it has to be epithelial. Your skin creates a border, remember? Well, let's take a look at some of the terms in the structure. So the epidermis has no blood. There you have the dermis, and then below the skin, hypodermis. Look at all this yellow. That's where your fat is. Your oil glands here help produce oil to protect your skin and hair. Your goose pimple or goosebump muscle is the erector pili. Can you control your goosebumps? No. So it's smooth muscle. It goes automatically. So when you're cold, it helps fluff up your hair, try to keep in the heat. When you're scared, fluffs up your hair, try to make you look bigger so you can scare away stuff. So it does it automatically. Sweat glands, another term for sweat gland is sodorific sweat glands. And there's different types of sweat glands. There's watery sweat, and then there's also stinky sweat or thicker sweat. Hair and nails protect the body. So hair in your nose, hair in your ears, right? Protect bugs and other stuff from getting in. If you didn't have nails, you'd bruise the ends of your fingers all the time. Let's see what we got. So here's hair growth. So you need hair follicle for hair to grow. Hair is just modified skin cell, and as it grows, it forms kind of like a tube structure, and it gets pushed up and out. So all you're seeing, the hair, that's all dead. The oil glands, the sebum, is connected to the hair shaft, whereas sweat glands, they just come out via any pore on the skin. Lenya Law. So it's white in color. There's no blood supply there from the nail bed. And you can use nails to test circulation, and if there's like certain ridges, you can tell if there's nutritional problem. Anybody have cats? Did you declaw them? No. When you declaw a cat, you have to remove pretty much their first digit, because the nail, you have to get rid of all of that nail root, and then it'll leave the cat defenseless. Now, as long as you have the nail root, your nail will grow back. So people who run marathons, sometimes they'll lose their toenails. Jam your finger in doorways, you might lose it, but it'll grow back as long as the nail. Sweat glands, soles of the feet. So they're more concentrated on the hands, soles of the feet. Axillary is under the arm, because when you use Axe deodorant spray, you're going to spray it under the arm. And forehead, your T-zone. So during puberty, your sweat glands, they change from making watery sweat into more thick sweat that can become odorous. So we have multiple types of sweat gland. We have apocrine, merocrine. So sweat glands are called sodorific. This guy's more watery. So little 5, 6, 7-year-old, they run around sweating. They're not going to stink because it's mostly water, a little salt. But the apocrine glands, right, they're going to be thicker. There's more stuff in it. And during puberty, they'll start to develop. And then 13, 14, these kids are going to stink. And it's not the sweat that's stinky. It's the bacteria that eats it. Their byproduct is what makes the odor. For women, these guys turn into milk gland under hormonal direction. So during puberty, in the breast, these guys will then start making milk, start producing them. Sweat pores on any opening on the skin, and as mentioned, the sebaceous gland, they're designed to condition the hair and skin. All right, let's take a look at some of these procedures, diagnosis terms. Viral diseases. A lot of skin conditions are caused by viruses. Can you ever get rid of a virus? No. So viruses will cause tumors, aka they can cause warts or papules like HPV. So a lot of our skin conditions are caused by viruses. Herpes as well. Varicella, that's like chickenpox. Rubella, everyone's vaccinated for rubella. Impetigo is highly contagious. Make sure you wear your appropriate protective equipment. Bacterial infection on the skin. Fungus, so these two are fungus. Tinea is like your regular athlete's foot. If it happens on your foot, tinea pedis. If it's on your body, corpus. If it's on your head, capitis. So they just name it where it occurs. Ringworm, is that a worm? No, it's a fungus. The reason it grows in a ring pattern is they can only eat dead stuff. Fungus can only eat dead stuff, so they'll eat the dead skin, but then they'll have to move out to the next layer to eat that next layer of dead skin. Itchiness, this is yeast infection. And then inflammation of the skin. Eczema. Who usually gets eczema? Young, old, very old? Yeah. It usually starts young, and then kids sometimes will grow out of it. Sometimes it persists forever. But for young adults, they usually get psoriasis. Have you guys seen gangrene? You'll probably smell it before you see it. So this is an active infection. All the bacteria, fungus, they're eating all that dead tissue. Herpes. So simplex 1 is in the oral area, simplex 2, genital, but they don't care. The virus, if the skin is good for them to attack and infect, they will. Blisters with the herpes. Cold sores, that's a herpes. Fever blister, that's a herpes. General herpes, that's already herpes. Shingles, what's shingles? The second time. So the chickenpox virus hides in your body, and then when you're old, weak, it goes, hey, let's have a party, and then it attacks those nerve cells. What causes warts? Virus. Toads don't cause warts. Maybe if toads have the correct virus on them, they'll cause warts. Plantar, where is that? Bottom of your, bottom of your foot. Not very comfortable, right? Acne, when the sebaceous glands are blocked, all the oil will accumulate. And when your body forms acne, a lot of times it's isolating bacteria. So it's encapsulating it with scar tissue. So that's why it gets bigger and bigger, because your body doesn't want the bacteria to spread. Psoriasis. Who gets psoriasis? Usually late teens, young adult is when it'll start. Sometimes you'll grow out of it, sometimes you don't. First, second, third degree burn. Which one do you think is most painful? Second? Third? How do you guys like your steak? Flame kiss. So in third degree burn, you're burnt to a crisp. It's brown and charred. So what happened to all the nerve endings? They're gone. So is there any pain? No. First degree burn, usually just the epidermis, whereas second degree is now the dermis. Where are all the nerves? In the dermis. So they'll activate, they'll trigger major pain. What are scabies? Yeah, so it might look like little pimple dots when you get scabies or mites, but it's actually the insect burrowing into your skin. So to treat it, we give you a shampoo, a body shampoo. Put it on, we'll put clothes on you overnight, and then hopefully it kills it all off. The whole family gets treated, burn everything. Neoplasms are cancers. Neo is new, plasm is growth. So if it grows rapidly, most likely it's going to be cancerous. What's the difference between a callus and a corn? Corns are on your toes, right? So it's just a special name for the ones on your toes. But a callus is a callus. A corn is a callus. When you get that horny tissue, you have a condition of keratin, too much horniness. Basal cell carcinoma. I think this is the #1 skin cancer, the most common. The good thing is it's not deadly. Second most common is squamous cell. Again, not very deadly. This is just the top layer of your skin that's affected. And if they just cut it out, it usually doesn't. This guy here, malignant melanoma, this one's deadly. So if your freckles change shape, your mole moves, got bigger, got smaller, it raised a little bit, that might be the sign of melanoma. So do your mole check, do your freckle check. Male pattern baldness. So ladies, is your dad bald? So if your dad is bald, it skips a generation. So if your dad is bald, you're going to give that gene to your son. So all your male heirs are going to be bald. So just have girls, I guess. But women usually don't get male pattern baldness, right? They don't get the cul-de-sac and the island. What women usually get is thinning of the hair or loss of hair. So that's called alopecia. So those old ladies, what do? They give themselves a fro and they bleach it blue, right? To make it look thicker. So it doesn't, you can't trick it. Plastic surgery. What do they use for plastic surgery? So it's not plastic. I used to thought it was. Plastic just means repair. That's all plastic means. You can get skin graft from different parts of your body. You can get it from animals.
What's a graft? Skin graft.
Yeah, skin graft. So they'll cut skin from another part of your body and patch it on. So if you have a burn here, right, we can't have an open sore. So they might take extra skin from your leg or your abdominal area, right, and then patch that. If they need extra skin, like you're going through major surgery, they'll stretch your skin. They'll put balloons under your skin, stretch it out, so now you have skin that we can cut and harvest to repair other parts of your body. Chiral surgery, using cold, but it's going to leave a blister, right? Because you're freezing that area of the body. Dermabrasion. So what's the easiest dermabrasion? Right, just use granulated sugar and lemon juice, and there you go. Once a night, and you're good to go. Same thing as debridement. For your skin or wounds to heal, we have to get rid of all the dead stuff. So we will apply an enzyme that will actually cause your body to like break down so it can slough off easier. So that's debridement. You can do it physically or you can do it chemically. Using electricity, we can burn areas. They use this parts of the skin. Just make sure the patient's grounded so you don't electrocute them. What's a biopsy? Yeah, so they take a piece of your living tissue, hence bio is living, and then opsy is to see. So they'll take a piece and they'll look at it under the microscope. Hopefully, normal cells, right? All right, that's a quick overview of skin and body membranes.